Throughout this month of April, we are engaging health professionals, trying to understand the health structure or an infrastructure that we have in Nigeria and to expect, what to do, how to do what it is that you're doing, and how to take care of yourself, how to prevent sickness. So we're looking at curative and preventive health all through the season. So today we're getting into a conversation around the rights of a citizen to healthcare. The right of a citizen to healthcare. So as a Nigerian, what does it mean to have access to health? What are you entitled to? When things go wrong, what can you do? Do we uphold the rights of citizens in our country, Nigeria? And to engage us in that conversation this morning, we have the pleasure of Dr. Stella Uwagu, Executive Director, Center for the Right to Health. And as we discuss medical rights, healthcare provision, and fundamental human rights. Join me as we welcome Dr. Uwagu to the studio. Good morning, Mom.
Good morning.
Great to have you, and thank you for joining us this morning.
You're welcome. It's my pleasure.
All right. So, Dr. Uwagu, when you talk about citizens' rights, of course, we've heard right to health, and we would like to first of all understand what are the rights that an average Nigerian citizen has to health? Can an average Nigerian, should we say, demand quality health service from government?
Well, the right to health is enshrined in the Constitution. It's also enshrined in the African People's Charter. It's enshrined in international documents. It is also enshrined in the not too recently enacted Nigeria Health Act. And it is the right to expect quality services within the healthcare system. So when you're ill and you need to access, when you need to access both preventive and curative care, you have the right to access healthcare that is from a professional, and you expect that healthcare to be safe. You expect that your fundamental human rights are respected in the course of receiving that healthcare. And that includes your right to autonomy, your bodily autonomy, that nothing should be done in your body to you without your consent. Nobody can force you to receive care that you don't want. So for you to know the care you don't want, you have the right to information in the language you can understand. So you need to know what is your diagnosis, what is the plan of care, what medicine are they going to administer, what procedure are they going to do, how are they going to do it, what is the side effects of the medicine, what are the complications or challenges that could emanate from surgery. So you need that information in the language you can understand. And that is the key point. In the language you can understand. We've had cases where a woman, somebody's leg was amputated, and the person actually, they gave him paper to sign, he signed. Meanwhile, this person does not understand English. And they spoke to him in English, and he was nodding his head. And at the end of the day, he didn't really understand what they were going to do with him. And when they went to court and the judge asked, what language did you use to explain that consent, to receive the consent? They said English. And then they were surprised that this patient does not understand English. So you may not have obtained proper consent. So you need to be able to break it down. And the individual has the right to refuse care that they do not, that they are not comfortable with. You have the right to seek second opinion. If you're not comfortable or you don't understand it, you should be able to get second opinion from another care provider. You have a right to confidentiality, that because it is if you cannot trust that the information you're giving your healthcare professional will be protected, you might not be able to tell them truthfully what is wrong with you for them to be able to get the best care. So you expect that what you tell your doctor or your health professional will be confidential. It cannot be discussed with any other person that does not have a role to play in your care. We had many cases of where people were, especially in stigmatizing diseases, where people like HIV, where people's HIV status or other stigmatizing disease condition were revealed to the employer, to their family, to other member, with significant consequences to the patient. So sometimes employers might send you to the hospital to do tests. What the report the employer gets back is something like, are you fit to work or not? Not specific diagnosis, because if they reveal those information to your employer, it's a breach of your health rights, it's a breach of your medical rights, a breach of your patient rights. That's a breach of confidentiality. So you expect confidentiality in the course of care. And then you expect to receive emergency care. You know, a doctor deserves to get their pay, because this is one that is really causing a lot of havoc in today's Nigeria. A health professional deserves pay for their service, but it is after the service, not before the service. In the case of emergency, the health professional should be able to provide, to give life-saving care, be it oxygen, be it transfusion, be it reducing bleeding, whatever you can do at that point to save the person's life. And you should put on a wall on your health facility what kind of care you can give and what kind of care you can be able to give, so that people are not coming there to ask for care that you're not in a position to give. We've had cases where people go to the hospitals and they're asking for deposit before care, especially in emergency cases. That is a breach of the right to life, the breach of the right to health.
I
Because
see.
without the right to health, you may not be able to have the right to life. So, and it's against the Health Act, the provisions of the Health Act. And then we also have situations where they ask for police reports before they can deal with accident cases or gunshot cases. That is strictly against the law, and citizens must know that and document and escalate it. You must give life-saving care and get the police report afterwards, not deny someone care because you're waiting for police report
Wow.
or because you're waiting deposit. So those are all your right as a citizen. You have a right to privacy. This is the one when I was practicing as a nurse that I find very challenging. Sometimes you go to the hospital, you will hear everything that is happening around you. You could even see the nakedness of your patient. That is absolutely wrong. You have to respect a person's right to privacy in terms of bodily privacy, and also the right to dignity. The right to dignity. This is the one that is really, that's caused a lot of people to die. Sometimes people
Okay.
cannot understand, how does the right to dignity, how can that cost their life or death? Yes, it is life, cost life or death. Let me tell you a story, because especially in our maternity care, especially this is particularly affects women and young people.
Okay.
Sometimes the way health professionals address patients or patient relatives make people appalled, dread going to hospital. You talk to them disrespectfully, you abuse them, you names because maybe they didn't pay a bill, or you look at them, they didn't seem educated or well to do, or they're shabby, and you could use that to yell at them and dress them abnormally. And then particularly in our maternity care, you could hit a patient or talk to some women would rather not go to the hospital than go to the hospital to receive those insults. And I've had a case of a relative that died. You know, if you go on YouTube, you could look at our video called Failed by Angels. It told the story
Did
of
you say
how a
bailed or
woman
failed?
failed, failed by
Failed.
angels.
Okay.
Yeah, because it just chronicled the stories of how Nigerians have been failed by the health system, by health professionals who are their angels, who are supposed to be their angels at their moments of need,
Help need.
but
Yeah.
they've been failed. So there's a person that refused to go to the hospital to have her baby because of the way she was treated the first time she had a hospital delivery. So she refused. A lot of women will refuse to go to the hospital because of the way they were treated or the long wait or just the general environment that just denies you, robs you of your dignity. And you find out that people will protect their dignity by all costs. And then during her second pregnancy, she had twins. She was expecting twin delivery, so she chose to have delivery at home. But guess what? She started bleeding. And in the course of that, she died. And the baby, they rushed her to the hospital, but they couldn't even get there. The children died.
So 3 people
So,
lost their lives because they were denied rights to
because
dignity
of
and
the,
privacy.
yes, yes, because of the denial of the right to dignity, because someone spoke really rudely to them in a way that wounds their spirit. You know, we had a saying that sometimes the way you treat people impacts their psychological well-being.
True.
You might not even, you might give them all the medicine in the world and you don't treat them with dignity, they might not even recover. They will die of heartbreak. You will see some people who will hold on to their poo or their pee because they dread calling someone
Mm.
to be able to
Mm.
relieve
They know
a
what comes
bodily
with it.
function.
The
They know
indignity
what
that
comes
comes with
with
it.
it.
Yeah.
Dignity that comes with it. And these are things we really, really need to watch, you know, because that kills. And sometimes it's even difficult to gather evidence of such situations.
All right. Now, I allowed you to read out this right, and I must confess that some of this rights, as you read that out, I was shocked that. So we have all this rights, and are they documented in Nigeria that it's in our laws that these rights exist?
Yes, it is in our laws. If you go online and look for the Nigerian Health Act,
2014.
yeah, 2014, it is there all listed. Another one that breaks my spirit is that has to do with our pharmacists and even our doctors is a patient's right to information about their drugs.
I was coming to that
Yeah,
because
about
you're
their
giving
drugs.
so much, and at times you ask questions about what is this drug used for, and the look the doctors will give to you at times, or the pharmacist is like, "What's your business? Just take the thing and get well."
Um, I have held up a whole hospital pharmacy because they refused. They didn't know I'm a health professional. And I asked them, what is the name of the drug you're giving my mother in law? And they said, oh, just give it to. I said, no, I am not accepting any drug that I don't know its name. Sometimes, even when the drug is in the packet, they will either cancel the name or tear it off or give you
Mm.
a blank envelope, an envelope without the name of the medicine. And they tell you it's because we don't want you to self medicate. Heck no. Let that be the decision. Who knows if I'm allergic to the medicine you're about to give me? And then if I become allergic to that medicine and I have to go, so if you're allergic, return, come back to the hospital. Do you know the distance between hospitals and where people live? What if I have to go to the nearest place to receive emergency care? And the person I'm talking to does not even know the medicine that I've been given and what I'm reacting to. How would they know the antidote? So if we all demand that we are not taking these drugs, because this is the relationship between the patient and the doctor or the health professional, the demand and meeting it. So if you must ask, the more of us that ask, that insist, especially the educated ones, even the uneducated ones, ask. Because you might be your son or your daughter or somebody might be asking, Mama, what medicine did they give you?
Mm.
What are you taking? What if the person collapses and you take them unconscious to the hospital and the person cannot even tell you, their relative cannot tell you what medicine they are on or what they took that they are reacting to. So I really want to talk to Nigerians and talk to our health professionals to treat Nigerians with dignity and respect, that it is their right to know what you're putting into their body.
Mm. And just for clarity, you're not speaking as a novice. You are a retired nurse yourself.
I am a nurse. I'm actively a
Still,
nurse.
it's still okay. So you know what you're talking about. You're talking to your cohort. I mean, your colleagues to say we need to
I'm
do this.
talking
Now,
to,
now,
yes,
just a question here. I know you practice. You're still practicing registered nurse, and you run your organization as well. Now, you have so much knowledge about what is going on in Nigeria and the rights of the people. But the question here is, how many Nigerians or how do doctors even know these rights exist? Or do they know, do they intentionally just ignore or avoid it? And I mean medical practitioners, not just doctors here.
yes, they know. we were taught. If you pass the exams, you know, it's the big patient rights is a chapter in any health professional course you're taking. You're examined on it. Even in your practical, those health etiquettes is patient etiquette, bedside etiquette. Those are part of what you are examined on. Okay, so they will know. But it's just that sometimes, even before we pass the exam, we write the exam to pass the exam's sake. That is one of the reasons I started Center for the Right to Health, because there was a dissonance between what I was taught as the standard and what I met in practice, even while I was a student nurse. And seeing the consequences of this dissonance between what we were taught as a standard and what obtains, and the impact it has on the patients was one, especially at the height of the HIV epidemic in the early 90s. That was what really motivated me to found Center for the Right to Health, because I believed, even with the fear and stigma associated with HIV, that if health professionals can learn to treat patients with HIV with dignity, that they can also extend those courtesies to every patient.
All right,
But it's
so
remained work in progress.
it's still work in progress. And with your Center for the Rights to Health, with all this now, not every Nigerian would read the Nigeria Health Act 2014. Is there another way through which we could sensitize them? Is there an abridged version, or are there links or places we could go to for this act or this right to be established? For example, is it possible that government could insist that the basic rights of citizens in the hospital, in the health sector, should be written or posted on the walls at the entrance of hospitals? Would that make any difference?
Well, you see, it will make a difference, and it is also part of what is in the Health Act.
Okay.
Hospitals should post the rights of the patients on the wall, and they should also post a number where patients can report poor services or disrespect or a violation of their rights.
Wow.
So if you go to, that is what the law stipulates. This is where we say the provision versus the enforcement. So if you go to a hospital, look around and see if they posted the patient bill of rights. There's something we call the patient bill of rights.
Right.
Even the Consumer Protection Agency has welled into this challenge and come up with the patient bill of rights. That should be posted in every health facility with a number, a telephone number, where you can report when those rights are violated. We at Center for the Right to Health and with other NGOs, we've been doing sensitization even before the Health Act was passed. And after it was passed, we summarized the patient bill of rights, we put it in smaller pamphlets, we were educating even the health professionals themselves, we're educating people in the legal profession, because if the magistrate that is you're coming to their court to report does not know that the act even exists, not to talk of knowing what it contains, how do you not get enforcement? So there is a need for education, just like what we are doing now. I'm hoping it will not be only during I know Nigeria has so many issues, but it will be good to continue to dedicate time to the media on this Health Act. The National Orientation Agency, I remember there was a time we did programs with them during the early days of the enactment of the health rights, where we did series of broadcasts to educate Nigerians on the provision of the Health Act. We at Center for the Right to Health will have continued to use social media to engage people on their rights. There was even a time we did something with UNICEF where we mobilized young people and showed them numbers to call and how they can report violations of health rights. Because sometimes even when your rights have been violated and you try to prove that your rights have been violated, sometimes it's between you and the powerful health professionals, and generating evidence can be problematic. And we told young people, you have your phone, use it. Collect evidence. evidence. Even if you can't get justice in the legal courts, which can be slow, let's name and shame. Let the media use their investigative journalistic strength. You don't need to go far. Walk into any ward, walk into any public hospital or private hospital for that matter. You will see those violations live to your eyes, and you can record that. Because without consequences, impunity reigns.
All right.
We
Now,
are
well,
in it.
when one thing I was going to ask you, you're already addressing it in a way, which is if you feel if you experience an unprofessional conduct in a hospital, a violation of your rights, where do you start from? How do you begin to address this?
There are multiple levels. The first level, collect evidence. Know the time that professionals are supposed to wear their name tag when they're attending to you. You could start by, if they are not wearing their tag, consciously ask for their name. So it's not one nurse or one doctor. Get names. Do you understand? So when you're going into health systems, just know that you're going for war, because you can come out, you may not come out. So begin to document what is happening around you. What is the name of the person attending to you? Who else is around you? Just get descriptive information as much as possible. What time did that happen? So even if you can't get the name, get the date and time. With that, they can administratively
Start the
trace
process.
the person that attended to you. So collect information, and then you could start from the hospital administration. Every hospital has a CND. Write down your petition and submit to them. Make sure you get an acknowledgement copy. Make sure you get the phone number of someone that you can follow up with to ensure that your complaint has been attended to. And then you can also report directly if there's a medical doctor that is also the hospital commission. That is in every state, they have their hospital commission. If it's a local government, they have a local government medical officer. You could also report directly on the website of the Nigerian Medical and Dental Council. They have a system there on their website where you can do an affidavit and report your case. You don't have to go far. You don't have to go to their office. You can do this online. You can also report, if it's a nurse, you can report to the Nigerian Nursing and Midwifery Council. The same with the laboratory people, the pharmacy people, they all have their boards, so you can report. Let's not keep quiet. Silence is deadly. You may have survived. The next person that may experience the same unprofessional care may die. So sometimes we tend to feel, Nigerians don't report, or we get so religious. Let's leave it to God. God is not going to do anything for you that He has not already empowered you to do for yourself.
All right.
It is a godly service to be able to report these violations.
All right.
And sometimes we get despondent and hopeless and feel like nothing will happen anyway.
Yeah.
But let's keep reporting and let's keep following up.
You said, I have a one very close to me who went to the hospital. The doctor attended to them and sharply just dismissed them to go back home and gave them some medication, asked them to go back home. But she went back home, kept feeling pains, and she decided to go to another hospital. When she got to the other hospital, they did their scan and test. The first hospital did the same thing. When the second hospital did the scan, the test, and everything, they just told her that this child in you is dead. Yes, that the child was lifeless. And it wasn't like, it's been lifeless for a while, which meant that the first hospitals must have seen it, yet allowed them go. We don't know what happened, and that has affected the family for a long time. So such a case, of course, typical Nigerians will leave it to God. God knows why He did it. But it is, like you said, it's important that we follow up on this and make sure that we bring people to book. But we've spoken a lot about the right to health, and we've not even scratched the surface yet, because we're still talking within the hospital. Now, let's take a quick look over the next 5 minutes at the rights or the responsibilities of government. Which of these rights have government breached? Is there anything in our law that dictates the amount of doctor to patient ratio that we should have, the kind of facilities we should have in the hospital? Are there rights enacted or regulations protecting such provision of health service?
Yes, you have the patient have it right, both the government or whoever is running a health facility. There is a responsibility to provide adequate number of ratio of health professionals to patients, depending on the facility you have, because that is what makes the service safe. If you overwhelm the health professionals, you cannot have safe service. It's one of the reasons why I started making intervention outside of the health system, because the right to health is bigger than what happens in the hospital. So if you do not have, and we really have serious problem with health human resource, the doctor-patient ratio is poor. At one time, I was at the emergency room and I saw a doctor practically work for 48 hours straight. There's no
48
way that doctor
hours.
would make. Yes, there's no way that doctor would make mistake. If you do not, if you have a high ratio of doctor nurse to patient, a nurse is taking care of 10 patients or more at a time, there's no way that person cannot make mistake. So when I saw the volume, if you go to most antenatal clinics, especially in the government, you will see hundreds and more patients, and it might just be two nurses taking care of them. There was, remember one time, even after we took our time to tell the nurse what my sister's health challenges is. By the time because I insisted on following her, because I lost my younger sister because they left the placenta in her womb due to poor health services. And that was one of the reasons when I came back, I focused on documenting some of these experiences. And my own sister, I said, no, I am not losing another sister. So I followed her to the hospital. And after we had spent time explaining the whole situation to the nurse, believing she has documented it in her folder, I insisted on following her to see the doctor. And when we got there, the doctor was just giving her routine antenatal treatments and all that. And I asked the doctor, did you read the special situation? The doctor said, what special situation? Which means nothing was documented. I had to start explaining my sister's unique circumstances. And that was when the doctor said, oh, no. This case needs to be referred to a specialist.
Whoa. So had you not
So
been there, they'll have gambled with their life.
I would have lost another sister because they wouldn't have understood her unique history to be able to give her the care. So it's a two-way process. So we need to work on the health human resource, health workforce, then the infrastructure. Let's even start with hygiene. I've gone to hospitals where I insist that I am not going to be seen in a dirty consulting room. And insist that they sweep the place. So if more of us are emphatic on knowing their right, how can they treat you in a room that is dirty? That is several patients in germs and bacteria are swelling, the floor is dirty. You can't go to the hospital and expect to see gloves. Patients have to come with their own gloves or buy their own gloves. So the health professional must be protected. The patient must be protected. The bathroom, you go to hospital bathrooms and toilet facilities, it is a horror. That should not be acceptable because somebody is supposed to be paid and is being paid to clean that place. But sometimes when they have these union services, nobody can talk to anybody, and then patients are the ones that suffer. So even the hygiene facility of the hygiene of the cleanliness and hygiene of the facility is a responsibility of whoever established that health facility. So you expect care that is safe, that is hygienic. You expect sometimes you go to the hospital, you might not even see the sheet on your
bed, the hospital bed. And even when you see it, you might be at risk if you just lie on it. It's better you bring yours and just put it on.
So those are infrastructure issues. Those are challenges. Then what about power? You've seen nurses delivering babies with cell phone lights. You've seen, I witnessed this. They were doing surgery on my dad and the power went.
Whoa.
You see the doctor sweating through operating.
How hygienic is that when a doctor is sweating? Because when we watch foreign documentaries and operation is ongoing, you even see people dabbing the doctor's face to prevent sweat from getting. But if our own doctors are sweating through,
You see, one of the reasons I got very, very passionate about this issue, when some of my people tell me I'm too emotional, is because I've seen it all. When I was trying to get my license, my practicals for my midwifery, we were expected to have certain number of deliveries. And in those, I think it was the mid-90s, so there was a hospital, I won't mention the name of the hospital, but it's a popular hospital in Ibadan. And when we got there, sometimes women come and you see there's only one cord clamp that they drop in what is supposed to be a disinfectant water. And then 3 or 4 patients are sitting in the labor room, and then you grab the cord clamp with all the bloody hands and all that, call this cut, and then some other person picks it up. And how will there not be rampant spread of HIV? Go to the baby and the mother. So it is some of these facilities. We have had situations at Center for the Right to Health where our role was supposed to be mainly advocacy. But sometimes we see situations in some communities, especially rural communities, where we have to reduce their labor suit. We saw a woman lying on a chair. It's not bad. She's lying on a chair, and nail was sticking out of this chair. We have had to fundraise to equip labor rooms, to put baking couch where women can deliver safely. So infrastructure is a major challenge in our health facilities.
It truly is. It truly is. So, Dr. Iwago, we'll need to draw the curtain here, but there are many things we want to look at. We're looking at the right of a citizen to, a patient to protect or guide the health details from your employers, the right to disclose or not to. We'll look at all that, but we might need to bring you back on another day this month because we have the entire month to discuss health. And we're looking at sensitizing, educating, getting people informed, and doing our best to transform, at least influence a certain kind of movement around this. So we truly do appreciate your time with us this morning.
I need to play a class action lawsuit against some of these institutions. Where a group of people that had an experience in any of these health facilities, let lawyers, I used to tell lawyers, why are you saying you're broke? You can get facilities, doctors and institutions as a way to push their hands to do the right thing.